Welcome to the OHM BOCES Pre-K to Grade 12 COVID-19 Toolkit informational video. The information provided in this video will explain the toolkit, outline the steps necessary to safely come to school, discuss what to do if your child has symptoms that could potentially be an indication of a possible infection with COVID-19, or if your child may have been exposed to someone suspected to be infected with COVID-19, and the process to safely return to school afterwards. Our daily lives have been impacted by the pandemic, and as such, we need to be aware and diligent in our behaviors and interactions to limit the spread and ensure the safety of all staff, students, their families, and the community at large. Due to the fact that COVID-19 is a new pandemic that the world has not experienced prior to 2020, we are learning facts about the virus and preventative safety measures of how to contain the spread on a daily basis. The material contained in this video presentation offers the latest information from the New York State Department of Health and may be subject to change as new information from current research about COVID-19 and safety precautions to limit its spread become available. The health and safety of your child and all members of the school community during the COVID-19 pandemic depends on an understanding of the importance of wearing a face covering whenever they are at school, practicing social distancing, and encouraging proper hand hygiene to limit the spread of germs. Combined with the knowledge of how to respond should your child or any member of the school community potentially exhibit symptoms of COVID-19, or if they may have been in contact with a suspected case, this toolkit was designed to be a reference that will address questions you, as parents and other members of the school community may have. Questions that may be of concern include, but are not limited to, what if my child is sick with COVID-19 symptoms? Does my child have to be tested? Do I have to let my school know? And where can I take my child to be tested? During the COVID-19 pandemic, as new information is made available, there may be terminology used by the Department of Health, the CDC, or other agencies in the health profession that can be confusing. In an attempt to assist parents and guardians of school-aged children understand some of the terms used, and to help clarify and define two of the most common, we will explain the differences between isolation and quarantine. Isolation separates a sick person infected with a contagious disease from people who are not sick or infected. When a person is in isolation, that person must stay home and away from other people to reduce the risk of spreading the contagious disease to non-infected people. Quarantine separates and restricts the movement of all people who are exposed to a contagious disease in order to monitor for symptoms of potential exposure and to see if they become sick. If someone has been advised by a health department to quarantine, it is a requirement, regardless if the reason was for precautionary reasons or mandatory reasons. During a quarantine, you may not leave your home or have visitors. All persons who are required to be in quarantine may not leave their home or receive visitors into their home. The New York State Department of Health has released a decision-making tool called the Pre-K to Grade 12 COVID-19 Toolkit to assist parents in determining when their child may go to school or when their child should stay home from school. Report any absences, symptoms, and positive COVID-19 diagnostic test results to your child's school immediately. Report to your child's school anytime your child will be absent if your child has any new or worsening symptoms that may indicate COVID-19, or if your child has a positive COVID-19 diagnostic test result. Please be aware of the urgency and timeliness of reporting to school. Seek immediate medical attention if your child has trouble breathing or is breathing very quickly, prolonged fever, is too sick to drink fluids, has severe abdominal pain, diarrhea, or vomiting, a change in skin color, becoming pale, patchy, and or blue, racing heart or chest pain, decreased urine output, or lethargy, irritability, or confusion. In the past 10 days, has your child been tested for the virus that causes COVID-19, also known as SARS-CoV-2? If your child was tested and has tested positive for COVID-19, or is awaiting the results of a COVID-19 diagnostic test, your child cannot go to school today. Your child must stay in isolation until they receive a negative COVID-19 diagnostic test result, or if the COVID-19 diagnostic test result is positive and the local health department releases your child from isolation. You must notify the school immediately if your child has been tested for COVID-19, as well as if the COVID-19 diagnostic test result was positive for contact tracing purposes. In the last 14 days, has your child traveled internationally to a CDC Level 2 or 3 COVID-19 related travel health notice country, or traveled to a state or territory on the New York State Travel Advisory List, or been a designated contact of a person who has tested positive for COVID-19 by the local health department? If your child answers yes to any of these questions, your child cannot go to school today. Your child must stay home until your local health department releases your child from quarantine. The requirements for quarantine restrictions will be in place for at least 14 days. Please note that even if your child receives a negative COVID-19 diagnostic test, but has answered yes to any of the questions listed on this slide, it does not change the 14-day quarantine restriction requirement. The OHM BOCES school community, including staff members and students, must follow the New York State Travel Advisory Guidelines and should stay informed regarding New York State's requirements for people returning to the state, as well as any requirements in the destinations they're planning to travel to. Anyone planning to travel out of state should consult the New York State COVID-19 Travel Advisory website. The information to access the website is on your screen. It contains the most up-to-date information. You may be required to provide your quarantine order, release order, or other documentation regarding your COVID-19 health status. Due to the high amount of cases being reported to the local health department, not all individuals may receive this documentation. If that's the case, consult your school on what information should be provided for your safe return. Does your child currently have, or has had in the last 10 days, one or more of these new or worsening symptoms? A temperature greater than or equal to 100 degrees Fahrenheit or 37.8 degrees Celsius? Feel feverish or have chills? Cough? Has a loss of taste or smell? Is fatigued or feeling of tiredness? Have a sore throat? Shortness of breath or trouble breathing? Nausea, vomiting, diarrhea, muscle pain or body aches, headaches, or nasal congestion or runny nose. If your child does not have any of the listed symptoms, they may go to school today. Your child must wear their face mask, wash their hands, and practice social distancing whenever they are in school. However, if your child answers yes to any of these symptoms, and the symptoms are new or worsening, your child is not able to go to school today. Your child should be assessed by their pediatric healthcare provider as soon as possible. When scheduling the appointment for your child's assessment, be sure to let them know that your child is experiencing COVID-19 symptoms. If your child's pediatric healthcare provider recommends a COVID-19 diagnostic test, your child must stay out of school and in isolation until the COVID-19 test results have been received. If your child's COVID-19 test result is negative, your child must have improving symptoms and be fever-free without the use of a fever-reducing medication to return to school. Your child may also return to school with either a note from their healthcare provider indicating the COVID-19 test was negative, or by providing your child's school a copy of the negative COVID-19 test result. If your child tests positive for COVID-19, they may not return to school until released by the health department usually after 10 days of receiving a positive COVID-19 diagnostic test result. If your child receives a positive COVID-19 test result, the local health department will contact you to follow up. Please be sure to notify your child's school and BOCES of the positive COVID-19 test result immediately. Your child must remain in isolation, at home and away from others, until your local health department has released them from isolation, which is typically 10 days after symptoms onset, your child's symptoms are improving, and the child has been fever-free for at least 72 hours without the use of fever-reducing medicines. While your child is in isolation, all members of your household must quarantine at home until released by the health department. The quarantine period for members of your household is typically 14 days. Please be sure to request a copy of the quarantine order as well as the release order from the health department. Please note that a repeat negative COVID-19 test is not required for your child to return to school. If your child's healthcare provider does not recommend a COVID-19 diagnostic test, they must provide an alternate diagnosis for their illness before your child may return to school. The alternate diagnosis may be a chronic condition with unchanged symptoms or a confirmed diagnosis of an acute illness. If your child's healthcare provider provides a diagnosis of a known chronic condition with unchanged symptoms or a confirmed acute illness, for example, the laboratory results confirmed a diagnosis such as influenza or strep throat, and COVID-19 is not suspected, then a note signed by their healthcare provider explaining the alternate diagnosis is required and must be provided to your child's school before your child may be allowed to return to school. Your child may return to school according to the usual guidelines for that diagnosis. Please note that a signed healthcare provider note documenting unconfirmed acute illnesses such as viral upper respiratory illness or viral gastroenteritis will not suffice, and your child may not return to school. In the event that your child has COVID-19 symptoms and a COVID-19 diagnostic test is recommended and not conducted, or if the healthcare provider does not provide an alternate diagnosis, or your child was not evaluated by a healthcare provider, your child must remain in isolation at home. Your child will not be able to return to school until your local health department has released your child from isolation, which is typically at least 10 days have passed since your child's first symptoms, and your child's symptoms are improving, and your child is fever-free for at least 72 hours without the use of fever-reducing medicines. New York State has set up free COVID-19 diagnostic testing centers at Griffiths International Airport in Rome. Appointments for testing are required. Well-Now urgent care centers offer COVID-19 diagnostic testing for those who display symptoms or may have been exposed to COVID-19. Primary urgent care also offers testing. Primary urgent care conducts rapid results testing. Anyone wanting rapid results testing for COVID-19 must be 6 years of age or older. PCR testing is available for children under 6 years of age. Anyone wanting a test to return to work, back to school, surgery, or travel will have to get prior authorization from the insurance company, showing their name and date of birth in writing, sent to us prior to being swabbed. Primary urgent care does not accept scripts as authorization. New York State continues to expand testing for COVID-19. COVID-19 diagnostic testing is currently available at select pharmacies, urgent care facilities, local hospitals, and more. COVID-19 diagnostic testing sites run by New York State are offering their tests free of charge. If you get tested at a private location, such as a pharmacy or medical practice, you're encouraged to check with your insurance provider prior to being tested to determine whether or not you will have to pay for the cost of the test. The role of the Department of Health is to protect students and their families during a public health crisis. Please be sure to answer your phone at all times in the event the Department of Health must reach you. If someone in your house gets sick, call your primary health care provider. Stay home if you are sick, except to get medical care. Use a separate room and bathroom for sick household members if possible. Wash hands regularly. Wash your hands with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. Disinfect surfaces and objects in the house, including tables, doorknobs, light switches, and remotes. Avoid sharing personal items like utensils, TV remotes, food, and drinks. And if you develop emergency warning signs for COVID-19, call 911 and get medical attention immediately.